Tony from Tahik, you're going to give us a demo of the Patient Portal 2.0. What's your role there at Tahik?
I am head of health division, and we are responsible for most of public sector health-related registries and information systems development.
Yeah. The total budget of Tahik is 40 million, and of that, 3 different things are paid for labor, etc. How much do you pay? How much do you spend on healthcare?
I believe roughly half of that.
Okay, and how many people? There's 200 people in the whole organization. How many people are working on e-health services?
Also related to e-health and to
50.
support all the services. Also, I think a bit less than 50, but around that.
Yeah. Okay. Good. So let's take a look at this beautiful portal, which is designed how many years ago?
It was designed more than 10 years ago.
Yeah, and actually it looks straight, and it looks nice blocks here. And so here you have all the personal information, and here you have the treatment invoices. Yeah. So can we take a look at the treatment invoices, see what every patient can see? And of course that's nice. So here you see all the invoices, and I can see how much money I spent. And you can show, you can see what's in the invoice, diagnostics. And this is one of the most popular things. And I can dispute this bill. Okay, do people do that?
Oh, yes, they do.
Oh.
Because this service creates also transparency.
Yeah.
And then it's possible also to discover frauds. So.
Okay, now, this is the old version, been used a lot. Popularity goes up, has been going up quite a lot. What were the ideas behind the new portal? What did you want to have in the new portal?
We wanted to have at first a really good user experience, so that the UI UX experience would be something that now in the year 2023 our customers
both
are expecting from us. Of course, both from mobile and also for visually impaired persons. Yeah. So we took everything into account.
Yeah. What else?
Then where do we want to go with this portal is that the current portal is more kind of copy of the paper-based world, where it's just possible to click, open case summaries, referrals, and so on. In the new portal, we want to visualize that information so that the persons actually can get a better overview about their health.
Okay.
And also,
so not only PDFs, but also nice integrated views.
Nice integrated views, and we can also use it for kind of nudging, for example, to promote their cancer screening, vaccinations, or other services like that.
Yeah, so it's really normal improvements. Yeah. But also it's more active, right? It's not only looking in the back mirror with the like the current system, but you can also book things.
Exactly. That we can also book things actually already with the nationwide appointment booking system, where all the largest Estonian healthcare providers are connected to it. So basically, this is kind of one-stop shop for doctor's appointments for the patients.
Wow! So you have a national system where every healthcare organization who is attached to it, they still can choose to do that. You can make an appointment.
Yes.
Okay. Wow, what a big, and that's new.
That's new already for 4 years.
Okay, so we're going to see how about that.
Yeah.
Okay, other things. Did I also see that you're going to switch from Oracle to another database?
Yeah, so from technology side, with the new generation health information system, technology-wise, we are moving away from commercial software to freeware.
Open source.
Open source, yeah, let's say so. So that instead of Oracle, we will have Postgre. Instead of WebMethods application server, we're gonna have Java microservices, and so on and so on. So we want these services to be, technology-wise, we want them to be future-proof.
Okay, so the whole database is going from Oracle to an open source version.
Yeah, the data goes to Postgre.
Postgre. Yeah. Okay. Wow. Okay. Then let's take a look at the how it looks.
How looks the new design?
The new design.
Let's see
the old.
If we can see the new design here. So here we are. Basically, kind of the same view. Here.
Oh, this is when immediately in the medical invoices, I can immediately see that I was spent 17,000 in this period from 20 to 25, 70,000, and I can basically, so it all looks a little bit more 2023.
Yeah, and of course, again, it's possible to see that what were the diagnoses and what was included what services were provided with that bill.
Yeah, and before I had to PDF documents.
Before we had also similar view, and it was of course it's possible to also print it to PDF or print it out if needed, but
okay.
And of course the same possibility to dispute an invoice either directly from here or to send via sending an email.
Yeah. Okay. Show us another thing. Of course, this this idea about having to be able to make an appointment everywhere, that's really nice.
Okay, here we see that there is an referral for cervical cancer screening. Let's see what happens now.
So before you can make an appointment, first you need to go to the GP and get a referral.
Exactly. So that's how it works. But with cancer screening, these referrals are created automatically. Okay. So let's check how it works. So let's try to book an appointment. Now then. Nationwide appointment booking system opened.
It's also, I also heard you're going also from your own data center to the cloud. Huh? You can also, that's also going to change.
It's going to change when the legislation will allow it, because at the moment our technology in the new system or the microservices, yes, they are kind of cloud native, so there are no worries with that.
Okay.
So yeah, but we can see the referral data, who issued the referral. For what service it is. We see that it's the cancer screening.
Oh yeah.
There's the expiration date, and now the patient can choose the country, for example, where he or she wants to go, or let's choose all countries. It's possible to choose a service provider.
Yeah.
And then we click search, and let's see who provides that service. Now the request is sent.
And isn't it now live? Also, this data is live. So it means the open, if people have open spots, that is going through the X road to the individual healthcare providers.
Yeah, exactly. No, the request went through the X road to the healthcare providers. Yeah. We got the results back, and these are the available time slots. Let's see what happens with the first one. I want to go to Northern Estonia Regional Hospital. So, only thing. What is needed extra? I can
phone number
or
as a check.
Email, as a check.
Yeah.
And let's see, and now confirm.
Okay.
So booking is
confirmed. Yeah. And the same thing if I want to make an appointment for just to get diagnosed. If the GP sends me there, I can do all kinds of different medical procedures and make an appointment and book an appointment.
Exactly. But GP has to make a referral. But it's possible to book time also without referral. But the difference is that the patient has to pay for the visit then. When there is a referral, then it is paid by the health insurance fund. So that's the main difference.
Yeah. Do still people do that without? Do you get quicker service if you?
Yes. Usually, it's possible to get quicker service also.
And you can still book via through the system.
Yes.
And then you have to pay, but you get faster service.
Yes.
Okay, but I'm sure you cannot see that. Okay, can you see if I don't pay myself? If I pay myself, do I have more slots available?
So it's possible to see from here that when, for example, I can book also time without a referral. Let's say allergology.
Yeah.
I'm not sure if there are any services, but let's. I have to choose a service source. Let's say visit an allergist. Okay. Now the warning says that. It needs a referral
or payment
because I don't have a referral. That's why we have that kind of warning there.
Yeah.
And now, just a moment. Let's see what is about to happen now.
And then I get more options. The healthcare provider could give more options if I want to pay.
Yes, usually it's like that. At the moment, in this test environment, it looks like we don't have any types of
but
that's how it works.
Yeah. Can you show the homepage for a moment to see where I'm coming in for?
You mean the patient portal homepage?
The patient portal homepage.
The old one, or?
No, the new one. The new one.
let's see, what do we have here? The homepage is about to be here, but
and are they this Terra Visual is the healthcare provider, the healthcare insurance company? Are they also the clients of the clients, the basic provider?
Terviseportal, which means it means health portal.
Yeah.
So it's just the name of the
okay.
portal.
It's not the name of the insurance company.
No, it's not the name.
Okay.
No.
So, and the homepage, if I log into the place, what do I get first?
Let's see, login. Now it went now automatically. Yeah.
Yeah, but now you're back. You're not back at the beginning phase. At the beginning, because you had to.
Let's see. At the beginning, I am here at the moment. So
yeah.
This is also, everything is currently under development. We have already 6 services here, and by autumn this year, all the services are transferred from old portal to the new one.
How many services will be available for this new portal?
Oh, I think maybe 20 something what we have already at the old portal. So.
And I can see exactly who went into my which provider, which healthcare provider looked at my data and looked at the different documents. I can say this document I don't want to have available for the doctor because I find it embarrassing. I don't want it. The patient is the boss.
Yes, that's how it is. So we say that the patient owns the data.
Yeah.
So it's possible for patients to close also the data. They can close everything. But when they close everything, basically it's not possible to get quality healthcare service after that. And yes, there is a logbook, so every action with the health data is stored, and from the patient portal it's possible to see that which doctor and exactly when and what kind of document was viewed. Let's check what do we have here in the portal logbook. Let's see, what can we have here? We see that there was a
login.
Let's see. Yes, there was now a request actually made by myself.
Made by yourself. Yeah.
And now we see that there was a list of referrals requested. So actually, it's also made by myself if I see it from here. But basically, if there would be a request made by a healthcare professional, then it is stored here with exactly the hours, minutes, seconds, and what kind of document was requested.
And if somebody does it illegally, you had an example of a police guy who basically looked at the healthcare records of his ex. What happens then?
Yeah, we have Data Protection Inspectorate who deals with that kind of situations. But the process is so that when, for example, we are contacted by the patient who claims that there's a doctor with whom he or she doesn't have any connection with, then the patient has to contact the healthcare provider, and then the healthcare providers have their own procedures for that.
Yeah, but if you do it illegally, you get 2 years, up to 2 years, 2 years in prison.
Yeah, maybe. Yeah, I'm not so sure about it, but maybe it can be up to that.
Okay. Hey, one of the new functions which is introduced today actually is the bio portal thing, so that you have risk markers based on your gene pool. When is that going to be available in the patient portal?
Early next year, so that then it's possible for the patients to give consent that their gene information will be used in clinical work.
Yeah.
So, and after that the process starts that genes will be analyzed, and first service will be risk scores for breast cancer.
Yeah, and it's 1/5 of the population is already in there. Huh?
Yes.
Yeah, and that's going to be just available for doctors and available for patients from next year.
Yes.
So you have a platform, you have security, you have every information is only stored once. Making new services is quite easy.
Technology-wise, it is easy. Hard part is to agreeing what to build, how to build, what are the processes there, what is the business behind that, what kind of data do we gather, and so on and so on. So
I thought that was really easy here. That's the hard in Holland, but it's also hard here.
It is. We are a small country, but still, that's the hardest part because technology is usually easy.
Okay, wonderful. Thank you very much, Tony.
Thank you.